It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, everyone. This is Tammy Patzer, and I'm really excited to introduce today's guest, Anne Margolis. Anne is a licensed certified nurse midwife, OB/GYN nurse practitioner, certified yoga teacher, and certified clarity breathwork practitioner. She's a third-generation guide to mamas birthing babies in her family and has helped thousands of families in her 20-plus year midwifery career and practice. And she personally has ushered the births of more than 1,000 healthy babies into the world. She's also guided countless human beings to heal from emotional pain, inner stress, and trauma, and to reclaim their joyfulness, calm, and overall sense of well-being. She is an international best-selling author of a few new books, but today we're going to focus on just one of them, and that is Natural Childbirth Secrets, an insider's guide how to give birth holistically, healthfully, and safely, and to love the experience. Welcome, Anne.
Hi. I'm so happy to be here. Natural birth secrets.
Natural birth secrets? What did I say?
Natural childbirth secrets.
Oh.
Same thing, but I don't know if that matters.
Well, we'll know that if they look up your name, Anne Margolis, they will find you. And this is a very interesting thing. So tell me a little bit more about your background, because you actually have had a thriving local practice, and you've helped people have more than 1,000 healthy babies. But now you're actually changing everything up. You've written this new book. Tell me a little bit about how you started out and what made you decide to bring your secrets out into the world in the form of a book.
Well, it all started, I guess my interest in maternity started back in nursing school when I did obstetrical nursing at University of Pennsylvania when I was in college. And I was like, I need to do this, right? But I never heard of a midwife back then. And I was all excited. And my first job as an obstetric nurse in New York, where I live now, is where I developed fear of birth. And I saw a lot of crises, and I saw as a nurse, I was having to rescue a lot of the problems caused by routine interventions to all moms and babies that were healthy. And all laboring women coming into the hospital were just getting this, one intervention after another, which caused another problem, and then just ended up in this cascade of interventions. And birth was scary, scary. It was like an emergency room. It was an intensive care unit. I did not see humanity. I did not see beauty. Stuff I learned about in school, in nursing school, but I just wasn't seeing that, So birth was considered a disaster waiting to happen, a potential lawsuit. And I did not always see good outcomes. And, moms and babies did not always make it or ended up in intensive care. And, so when I was pregnant with my first baby, I had a lot of fear. And I gave birth on the unit. I mean, I just thought this was standard operating procedure, but I did give birth on the unit where I worked. So I was given the royal treatment. Wow, one of the nurses, our own nurses, giving birth on our unit. But it did not feel like royal treatment. I mean, as soon as I put on that hospital gown, which is, then I felt kind of like, okay, you guys know everything. I know nothing. I'm this dependent, sick patient. And now I know I was just this healthy woman having a baby, which is a normal, healthy process. But I didn't know that then, right? So, I just kind of relinquished my power. And then, all the stuff that happened to other women was happening to me. I was told not to eat and drink, put in a bed. attached to continuous monitoring. And, just that alone prevents a woman from laboring normally. It's a huge event for the body. It's like running the marathon without fuel and hydration. No one would do that. And you need gravity, and you need to be moving around. And my body needed to be, moving around to cope with it and to ease my labor. And I was told I had to be completely still so they can monitor every heartbeat and contraction that I was having. And so, of course, I wasn't laboring well. And I was put on a time clock. You have to be dilated a centimeter an hour. And the doctor, my colleague, a lovely, nice man, kept coming in and sticking his hands up me without even telling me what he was doing or having a conversation, walked out. And I would hear him tell the nurse outside my room, she's still 4, she's still 4, she's still 4. And at one point, he told her, hang pit. Now, as a nurse, I know what that means. That means, giving me now the Pitocin medication to augment, to make stronger my contractions and speed up the labor. But that also makes it more painful. So, and that also increases risks for problems. And when the nurse came in and she was putting it in my IV without even telling me what she was doing, I said, I don't want Pitocin. I know what that is. And she says, oh, but honey, you don't want a cesarean, do you? I mean, she meant well, but no, I didn't want a cesarean. So then I was, feared into that. That was my biggest fear, was having major abdominal surgery. I'm a dancer, and I was very athletic and agile, and I was young, and I had, seen not great things. And I was really in more operating rooms than delivery rooms at that time. And I was scared of surgery. And then, of course, the contractions, everything got stronger and harder. And, it was like agony. My Lamaze went out the window. And then, the doctor, I heard him outside, just give her an epidural. And, they're giving me this needle in my, around my spinal cord fluid. And then my worst fear happened. My baby's heart rate dropped to very dangerous level. And everyone looked panicked, which made me panic. And they said, stat cesarean, like we need to get this baby out now. And so I had all these this frenzy, this crisis of, frightening eyes around me and whisking me into the operating room. And I knew, based on how low and how long her heart rate was that low, they had minutes to get my baby out. So then I'm left alone in the operating room, and I'm watching the clock, 10 minutes, 20 minutes, 30 minutes. They were waiting for the assistant surgeon. And this is in a hospital where I'm supposed to feel safe. They passed the time where they had to get my baby out without oxygen damage. And then it's 45 minutes, and then it's an hour. And I literally, at that point I was convinced she was dead. And the doctor, the medication of the epidural and the Pitocin altogether just took over my body, and I started pushing in the operating room, all prepped and ready to have surgery. So I started calling for help, and the doctor comes running in. He didn't know what to do with himself. And he sees me pushing, and he's like, get me a vacuum. And he cuts this big episiotomy and vacuums. He puts a big suction on her head and vacuums her out in the delivery room, in this operating room. And I couldn't look at her. Like, I knew that I was afraid of what I would see. I didn't want to see a dead baby. And they said, she's fine. Just look, she's pink. She's looking around. Like she was almost like unfazed by all this. I mean, I know now what I know about trauma, that she was probably very, getting all the traumatized by my trauma and stress hormones. But I was not fine, and my what I know I had was post-traumatic stress disorder, which is a birth trauma reaction to, it's a normal body reaction to such horrific experience. And I don't even know how I went back to work. I had all the symptoms, nightmares and flashbacks and panic attacks. And, I had all the symptoms of PTSD and birth trauma, but no one talks about it. Then everyone was like, you have a healthy baby. What are you worried about? And so I stopped talking. I didn't have anyone to talk to. And the modern medicine just does not take seriously the profound psychological impact of having a baby, on mother and on baby, so just as if everybody's breathing and has a heartbeat and there's no brain damage, everything's fine, right? But yeah, and I said to my husband, never again, don't want any more kids. Like that's how serious I felt. Seriously, I felt ill, like torture in my body when I thought about it. Of course, I'm pregnant 2 years later, and I had a similar experience. And so I was talking to a colleague of mine about my frustrations, about my frustrations from my own birth, and about how, as a nurse, I was just seeing all this going on. And she said, "Why don't you be a midwife?" And I literally said to her, "What is a midwife?" And there was no internet back then. I went to the library. She told me what it was, and it was like, wow, like that was, I'm home. I did research and I applied, and that was, the journey of coming home to myself. And I remember in midwifery school, and the more I learned about the midwifery model of care, and the crises and the medical interventions were more the exception than the norm, and that birth was beautiful and it was just a normal, natural part of life, and that the best intervention is no intervention. It's actually to give the power back to the woman, to the mother and their family, and that it works, and you just encourage and support and let it happen. Of course, we're trained and skilled in assessing and screening and emergency care and managing things simply and keeping it normal, but it was this teamwork of midwives who specialize in normal, and obstetricians who's actually are surgeons, and they specialize in high risk complications and disease. And that's what, that's the teamwork that we're seeing the best outcomes, like in parts of Europe, certain, Scandinavia and the Netherlands, and there's, parts of the world where we're seeing really excellent outcomes. And the United States is ranking pretty much near the bottom as compared to other developed countries when it comes to maternal and newborn morbidity and mortality, despite having the very high technological interventions and operative deliveries and very high C-section rates. So anyway, so when I went to midwifery school, I was pregnant with my third baby. And I said to my midwife now, because I was preparing with a whole different mindset now and different team. And I said to my midwife, I believe in this. I really do. But it has to work with me, for me to authentically promote this and to be able to help women have pregnancies and births and postpartums and in this way. Right. So she said, "Oh, don't worry. It's going to be so healing." And but really, my third birth was so healing and so beautiful and so relaxed, and she was with me the whole time. And yes, she's monitoring my baby's heart rate, but I was in the shower and I was dancing, and it was very laid back. And I when I did that on my own, I felt like screaming from the rooftops. I'm so proud of myself. I felt healed. I felt like if I can do this, anyone can do this. And so then I felt like I could authentically stand by women and help them not only have births that are healthy, but births that they love, births that are empowering, and remind them of their strength and the beauty. It restored the humanity to the whole process. And so so then I worked in a hospital where it was a doctor midwife team care, which the obstetricians had 6 midwives, and that was my first job. We were doing like 40 births a month in that hospital, and but the hospital loved the midwives, and the obstetricians loved the midwives, and we loved the obstetricians, and it was just, we worked together as a team, and even so much so, like they felt that everybody benefited from midwifery care, even people who were categorized as having high risk situations, women with seizure disorders or insulin dependent diabetes or heart disease. They still wanted every woman to benefit from the midwifery care, and just call that, they would manage anything complicated medically or surgically, they would manage that. But and that's where I worked for a while. I started my home birth practice with a dear colleague of mine, and after the first year, we were like rocking. We were booked. We were just very busy, and I had a very thriving local practice, and I still do, and like comparative to let's say my outcome rates are very healthy outcome rates, and women are having not just healthy outcomes for them and their babies, but they're loving their experience. I've had women dance their babies out, laugh their babies out, sensually release their babies out, or like sort of in sort of a yogic, breathing their babies out, and loving their experience, and so I just sort of developed this unique way of preparing women to have not just a healthy birth, but a birth that they love, that a birth with pleasure and joy, and that's unique to each woman. And my daughter, she said to me a couple of years ago, maybe 3-4 years ago, "Ma, you are so passionate about helping women and their families. Why don't you be on Instagram? You get these awesome pictures from your families, gorgeous birth pictures, and Instagram is where all the younger, childbearing generation is." And I'm like, what is I literally, it was like, what? Like one more online thing. And, but she's like, oh, no, it's just post your picture and be yourself. So she gave me the 101, and I started posting. And I just for as a, because I love to, I did want to reach out. I have this mission to improve, women's experiences, all, globally. I do feel that way. I did feel that way then. And also I was hearing from a lot of women that had such terrible experiences the first time that they wanted to, have a different experience, a much better experience with me. So I just, was posting, and who knew that in a few years it would be over 90,000 followers from around the world. And that started, I was getting questions all over social media from moms, in Australia, in New Zealand, all over, Europe, and all over the States, Canada, really all over the world, asking me the same questions. They all were interested in the same things, and they loved my page, and they wanted to help a happy, healthy pregnancy and birth experience, and asking me questions like, my doctor wants to give me a cesarean because I'm over 35. How can I prevent that? Or do I have a say? My baby's breech, and my doctor's just scheduling a cesarean. Is there anything that you would recommend to naturally turn the baby? And then I would get questions from the professionals, like other midwives, doulas, childbirth professionals, all sorts of, chiropractors, acupuncturists, anyone who's serving pregnant women about, like, I have this pregnant client and she's this, that, or the other thing. And what can I do? Or how can I have a successful practice like you? So that kind of births all these like online services, because that's not something I can really answer on Instagram or, Facebook. So, yeah, I don't know if that answers your question, but it's
very interesting because
I've been interviewed on all these podcasts and shows, and one woman interviewed me from San Francisco. She interviewed me. She had a podcast for doulas, and she said, "Do you travel? Like, if I want to have you as a midwife in where I'm living out in California?" And I'm like, "That sounds very." I have traveled before, and I would. She's because you have this unique way of providing midwifery care, and there's people that don't have access to you. Maybe you should make a course. It came out on a podcast. Do you have a course And I'm like, no. Well, she says, well, how about, I'm in film and my sister's in editing. How about you come out to California and we'll make a course, like take us through your practice. You need to have other people be able to reach what your message is. So I was like, I took her up on it and we became very close friends, and I flew out to San Francisco and we rented a cottage in Point Reyes and filmed my course. And for about 4 or 5 days. And so that I had something to offer people who ask a lot of very similar questions, and they want to know, how can they prepare for the most healthiest, joyful, mind, body, heart, soul, pregnancy, birth, postpartum, and parenting experience. And so that's how that birthed the course.
What is the course called?
Love Your Birth.
Love Your Birth. So you actually were being interviewed on a podcast. And this is just for everybody listening, the power of media. You were actually interviewed on a podcast, and the host, was she pregnant?
She had 2 babies with a midwife. She loved my approach. And she met me. She's been following me since when I started posting on Instagram, and she just loves my approach, and she wants to know how she can find other midwives like me, or what about people that live other places, and we need to spread your message globally, to people who aren't on Instagram, to people who want to go deeper, right? And then it also says a lot of times people would ask me very personal questions, and so that sort of birthed this online consulting. And so my work has gone from practicing locally to really, I'm on Skype a lot now with people all over the world. They just want, with real concerning questions. They don't have access to a midwife, or they're, they don't have access to the kind of holistic advice that I, or counseling that I would provide. So that's how, that just birthed that online consulting. And then it was interesting. On the podcast, she said to me, "You should also write a blog and a newsletter because you have a lot of fans. People that want more information, right?" And we started talking about it, and she just had this passion for what I'm doing and my passion, right? And so that kind of we spoke about it, and I said, you know what, I do get very similar questions from women. There's a lot of questions that women will ask me, whether they're in Australia or France or Iowa or British Columbia, Canada, right? I get the same question. Do I need a doula? What if my family doesn't agree with my birth plan? Or how do I cope with pain? I got a lot of these similar questions. And so what I decided to do is have a newsletter every month that was called Ask the Midwife, and that people would sign up to subscribe, and I would answer questions that I was getting most commonly each month. And that would be a newsletter and a blog. And that's eventually kind of birthed my book, and it really takes women from, how do I get pregnant? How do I get pregnant naturally with, all the way in down to, tips for breastfeeding or sex postpartum, or how to prepare for postpartum. Right. So, that was the basis of taking I don't know how long this book is now, because it's coming out in print version soon, but on Kindle it's what?
350
pages. What I've heard is very long for Kindle.
That it's a hefty volume.
Right? But
current
it's
modern
really a collection
information. Because I think that if you look back in time, there may have been books about having babies, but the information was so old. And your information is, like you said, it's holistic, healthy, and you cover the gamut from pre-pregnancy all the way to post-pregnancy. and everything in between. And I think it's interesting when you were saying that you get the same questions from women no matter where they are in the world, because, having babies is a universal thing.
Right.
And, we all are worried and wonder, and it does make me think about, I bet that a lot of the listeners, including me, we're all thinking, if we have had children, about the doctor's appointments and how short they may have been, and how, yes, why do they put you in a hospital gown? I even walked in, I was having contractions 5 minutes apart, and I knew, I was in heavy labor. And when I walked up to the counter and said, I'm in labor, the contractions are 5 minutes apart, the lady looked at me and she goes, you couldn't be in labor with 5 minutes apart. You wouldn't be able to walk. And I'm like, well, I'm here.
Wow.
I actually drove myself to the hospital.
Wow.
In labor. So I'm, and again, you're driving along going, oh yeah, it's happening. But it's so interesting how you went from the fear of, actually being an OB nurse and knowing all the things, but yet having two bad situations during birth because you were in that sterile environment, to learning that, hey, it doesn't have to be a medical procedure. And I think
I had two babies the other way.
I think that's what so many of us have had. It's like we were acted like we were sick and not having normal, natural, healthy childbirth.
People don't know they have a choice, and really this is it's a fluke of history, the last few generations, because for thousands of years birth has been a family event. It took place within the community, within the family. Women supported women, so women were, it could be the sister and the aunt and the grandmother and the mother-in-law or the woman's friends. Everyone was surrounded by birth and helping that woman, and it was just part of life. Right. And now it's been removed to the hospital and turned into a medical event. And so not only women aren't exposed to it, but they have this false sense of safety in a hospital setting when they're not sick. Like normally we don't go to the hospital if we're not sick. Like if we have our periods, we just have our periods. If we're going to the bathroom, our body knows how to go to the bathroom. Our body knows how to our heart knows how to beat, and how to breathe. We don't need, once you start poking and interfering and causing, all sorts of tests and diagnostic procedures on normal bodily functions, then they don't function well. Right. So yes, it obviously if someone has a dis-ease process, then that's a whole different thing. But the vast majority of pregnant women are healthy and their babies are healthy. And so it's just, it's really returning women or to reclaim their, or helping women return to how it was, reclaiming their power, even in this world of technology and science. And it's what's interesting is all the science, now we need research to come out to say it's actually beneficial to eat and drink in labor. It's actually harmful to be restricted to the bed. It's actually beneficial to move and be upright, right? These are the ways we've been doing it for thousands of years. Now we have science that just backs that up.
Right.
But women are just, a lot of women just don't know. They're not exposed. Birth is now in the hospital, and then they're hearing horror stories from their friends. Or, the media has hyped it up. I mean, I don't know if you remember I Love Lucy. It's still going on, but she had her first contraction and it became this, oh my God, call 911. And she and her husband start getting tangled in the phone cord and they're running and packing the suitcase. And it's like this crisis. And, that's kind of how, the music and the drama, it's kind of how birth is portrayed in the media. So there is a lot of fear. So much of what I do is to help women get back their calm, to alleviate their fear, get back their confidence, realize that they're strong. They're stronger than they know, and they are capable, and their body knows exactly what it can do. what to do to grow, birth, and breastfeed their baby if we just get out of its way. We need to get our big inflamed left brain out of our way, right, and tap into our intuitive and our sensual and have fun. There's no reason it can't be fun and pleasurable and joyful.
Wow. Yeah, well, I've already had 3 kids, and I'm not going to be able to enjoy it in the way that you've described, but wow. So if somebody wants to get in contact with you and learn more, what's the best way to do that?
So it's interesting. My website is called Home Sweet Home Birth, BIRTH.com. But it's not, especially now that my work has gone global, it's not about me convincing people to have a home birth. It's using the home birth, encouraging the home birth model of care in all settings. In the hospital, you can have that same sort of normal, natural, physiologic, beautiful, family-centered, pleasurable birth, but you just have to learn how. People ask me this all over the world: how can I have a home birth like experience in the hospital, or even a cesarean? If cesarean birth is needed, my C-section rate's 5%. It really should not be much larger than 10%, according to the World Health Organization. But some hospitals in the United States are 30, 40, 50%. Our national average is above 30%. This is malpractice. Right. But if a cesarean is really needed, and it can be life-saving, obviously, if it's really needed, what can we do to have that home birth model of care in there, that humanity, the family-centered? They have what's called a gentle cesarean. We can play music and have the woman, she can don sterile gloves after she washes her hands in a sterile way, and she can catch her own baby. We can take the drape down. She can have the baby come to her skin to skin and leave the cord clamping. There's early immediate breastfeeding. There's things we can do in the operating room to make it more cozy and more individualized and more, restore the humanity even there. So yeah, it's that model of care in out of hospital, which would be home birth or freestanding birth center or birth centers in the hospital or hospital.
Wow. So there's that would be really nice if you did need a cesarean to have that type of access, because I think that's, from everyone I know who's ever had a cesarean, that seemed to be something that really bothered them a lot, is that they didn't feel that connection. It's
a birth. It's not yes, it's a belly birth, but it's a birth, and it's something to be celebrated, and it's something beautiful. It's not, it doesn't have to be, it has to be sterile, but I'm saying it doesn't have to be just abdominal surgery.
Right.
It is abdominal surgery, but it's also a birth. So how can we bring those elements in? And what I'm finding, I got this amazing testimony from this woman in Central America, where they do have a very high cesarean rate, and she was stationed in Central America because of her husband's work, and she was pregnant, and her obstetrician just kept telling her he only does cesareans. So she's going to have a baby by cesarean. And but I want a natural birth. He's like, well, you're not in my practice, right? I don't do that. And she took my course, and that's all. The next thing I know, she sends me this beautiful video and this love letter about how she felt so empowered just by taking my course, that she convinced this doctor, who only does cesarean operative deliveries, to attend her naturally. And she had the most beautiful birth, and it changed. Can you imagine the ripple effect, how that was for him to do that, and how that's going to affect how he cares for other women and in his practice. And I really think that change is not going to come from trying to change hospitals and doctors. It's coming from empowering women and their families with the knowledge and with and that they can speak up, and that's where change is going to come. Passionate women and their families speaking up and making evidence-based, informed decisions that this is what they want. Hospitals, doctors, midwives, we are not law enforcement agencies. So people have a voice. They don't realize, when they get into the hospital and they put on that gown, they think they have no power. They have autonomy. That's medical ethics 101. they have a voice and they have a choice, as long as it's obviously not going to harm them, anybody. But usually parents just want what's best for themselves and their babies.
Wow. Well, everyone, I am going to be inviting Anne back for some additional interviews in the future. So just take this as a part of a continuing conversation. And everyone, thanks to Anne Margolis and homesweethomebirth.com. Go check it out. She has a blog. She has videos. Her Love Your Birth course is there. There's a lot of high quality information. Of course, you can find her on Instagram, YouTube, Facebook, Twitter, and probably every other social media.
Well, now on Amazon, there's the book.
And the book is on Amazon.
Natural Birth Secrets, yeah.
You can find it there. And again, like I said, it's an international best-selling book, and it is jam-packed, full of information. If you loved just listening to everything that Anne has talked about here, that book is very comprehensive, and it goes along with the website. And again, you can talk to Anne directly or take her courses. And she is available globally through the magic of Zoom and Skype and Facebook. So that's really cool. So thank you again, Anne. I really appreciate it.
A pleasure. Thank you.
This is Tammy Patzer. Go make it a beautiful day.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit optimalhealthradio.com.